training module highlights how to get started with the Infectious Disease Emergency Response Toolkit. It was developed by the San Francisco Bay Area Advanced Practice Center. This presentation provides an overview of the IDER Toolkit and identifies when the IDER Plan would be used and reviews steps for developing your own IDER Plan. What is the IDER Toolkit? It was designed to assist local health departments to prepare for and respond to infectious disease emergencies. It includes an infectious disease emergency response plan that can be either adopted in its entirety by a local health department or components can be merged into an existing emergency response plan. Because emergency management tools were originally designed for fire department and police department responses, they haven't always been as applicable for public health responses. This toolkit takes those existing emergency management principles and applies them to infectious disease emergencies, which can be a little bit unique. They're unique in the sense that the duration can often be uncertain. They can last between a few days and many months. They may require specialized medical and other knowledge for a response. The information may be rapidly changing, and because outbreaks can often be on a large scale, mutual aid from regional partners may not always be available. So when would an infectious disease emergency response plan be used? Primarily in an event caused by a biological agent, including bacteria, viruses, or toxins, with the potential for significant illness or death. This could include a naturally occurring outbreak caused by measles or mumps, an emerging infectious disease like SARS or pandemic flu, or bioterrorism attack like an anthrax attack. The toolkit includes a variety of components, including an overview, a planning assessment tool to assist local health departments determine what pieces of the IDER plan make sense for them, an IDER plan template, which includes the plan, annexes, appendices, and organizational charts for use during an emergency, training materials, and tabletop exercise materials to help train staff to operationalize the IDER plan. So who should use the toolkit? It was primarily designed for local health department staff who are involved in emergency preparedness planning. Ideally, they would have Incident Command System or National Incident Management System experience. The IDER Toolkit was originally developed using promising practices. A large review took place that looked at emergency planning resources across the country. We looked at best practices, lessons learned, and other tools, and modified these and incorporated them into the existing IDER plan. A key feature of the IDER Toolkit was to ensure that it was easy for other local health departments to quickly adapt so that they'd instantly have their own infectious disease emergency response plan. Another key feature is that staff were not required to have extensive experience to actually participate in a response. Although we always support and encourage training, sometimes you have staff who get involved in a response who haven't had the benefit of that training. The IDER plan provides detailed guidance, job action sheets, and other tools so that staff who haven't had that opportunity can instantly become involved in a response and instantly be an active and positive component of a response. Another key feature of the IDER plan is that it addresses all situations. In the past, you may have had a pandemic flu plan, an anthrax plan, and a foodborne illness plan. However, with the IDER plan, you have one plan that can address a variety of different types of situations. This is enabled because you have an organizational chart where certain boxes and functions can be activated or deactivated depending on the scenario. The staffing structure can be scaled up or down depending on the size of the response, depending on the scenario and on the situation, which allows the plan to be not only a detailed but also flexible response tool for all types of infectious disease emergencies. Finally, the Infectious Disease Emergency Response Plan is compliant with the Incident Command System, ICS, and the National Incident Management System, which are state and federal tools for emergency response planning and activations. For more information about both ICS and NIMS, go to nimsonline.com. So now that you know a little bit about the IDER Plan, how do you get started? First, go to the website and review the many components of the toolkit. Browse through them and watch some of the videos like this one. Then use the planning assessment tool to review your own local health department's plan and identify weaknesses, gaps, strengths. After you've done that, you'll have a sense of whether you want to adopt the entire infectious disease emergency response plan or instead merge specific sections into your own plan. Then start modifying the templates that are included in the toolkit. Make sure that stakeholders have an opportunity to review the draft version, and then once you've finalized it, share the plan with staff and other partners. Next, you'll want to make sure that staff are trained on the plan. We've included a training guide and a training PowerPoint slide that you can easily modify to match the plan that you've finalized. After the staff training, you'll want to give your staff an opportunity to actually operationalize the plan. So hold a tabletop exercise. We've included an exercise slides and a coordinator's guide in the toolkit so that you can easily and quickly hold an exercise. Lastly, your plan's ready to be used. You'll be able to use it for future exercises and real events. At the San Francisco Department of Public Health, we always evaluate our activities and make corrective actions to our plan so that our plan continues to be a living document that meets the needs of our staff and any emergency response we might need it for. For more information about the IDER Toolkit, visit our website at www.sfbayapc.org. We're happy to provide one-on-one consultation to local health departments. Just give us a call. Our number's 415-554-2830. For more information, again, visit sfbayapc.org.